I'm Jamil Asaria, and I'm the founder and director of Face Toronto. I'm a facial plastic surgeon based here in Canada, and I've been in practice for over 10 years now. I'm the Canadian Region Director for the American Academy of Facial Plastic and Reconstructive Surgery. I teach at the University of Toronto and direct their course and their curriculum in facial plastic surgery. And I'm a consultant for the Toronto Raptors basketball team with any head and neck surgery related issues. A facial plastic surgeon is somebody who focuses exclusively on the face and neck regions. They perform both cosmetic and reconstructive work of the face and neck areas, two areas that are really the most complicated anatomically and technically when we think about surgery. It takes many years of dedication to specialize in this field, generally at least 6 years of training, and surgeons come from a background in otolaryngology, head and neck surgery, oculoplastic surgery or plastic surgery, and then spend extra time focusing on this particular region. The consultation process is really the most important piece of the whole journey in facial plastic surgery. I think both from my perspective as well as from my patient's perspective, it's the time where we can discuss exactly what somebody's looking for. Before I can determine a plan or a specific procedure from a patient, there's a lot of background information that I need to know first. I need to know their personality. I need to know what their desires are. Do they want a large change? Do they want something very subtle? And each one of us are different in that perspective. We come from different backgrounds, we have different ethnicities, we have different professions, and our aesthetic sense is different. My goal during that consultation process is first to understand that. And then following that, using photographs, using verbal descriptions, using a variety of different tools to allow my patients to understand what's possible. So what can they choose? Can they go from A to B or A to C or A to D? We need to see the whole picture and see what options are available. I think the consultation process for hair transplantation is really one of the fundamental parts of the whole process. It's during this initial meeting that, through our analysis, through talking to the patient, through understanding what their hopes are, analyzing what their background is, determining what their family history and pattern of hair loss is going to be, that we can put all those pieces together and determine the exact right plan for a patient. We all know that patients want more density. Certainly they all want to look completely natural. The last thing somebody wants is for their hairline to look like it's been transplanted. And certainly with today's methods, that shouldn't even be a consideration when it's done with somebody with experience who can ensure that it looks as natural as possible. But we also have to consider how much donor hair is available. How much reserve hair do they have for future hair transplantation? Where is their hair going to age over the next, not just 2 years, 5 years, but over the next 20 years, over the next 30 years? And it takes somebody with experience, it takes somebody with artistic vision, and it takes somebody who understands how that process is going to occur to create the right shape, hairline, and design for a patient. Rhinoplasty is really one of the most unique facial plastic surgery procedures, and that's because there's so much that goes into it. Starting right from the beginning, there's a different aesthetic sense that every patient has. Some people want something quite dramatic or really refined. Some people want something that looks very close to their original starting point. And our nose is in the center of our face. I tell patients you can't put a shirt over it if you don't like it. So they have to really be committed to the process. They have to understand what they want, and I have to really be able to understand what they're seeking. There's much more into it than just kind of picking a shape and saying, this is the perfect ideal nose, or these are the measurements that make a nose look perfect. Because the first thing I need to know is the patient's personality, because a lot of it depends on their background, it depends on their ethnicity, it depends on their approach to life. So I like getting to know my patients first and trying to determine what exactly they're looking for. After that, there's a lot of things from my experience that I need to relay to patients. So what will look good on them? What will fit their other facial features? And most importantly, what's possible? Because the thing about rhinoplasty is that there's not just one shape or size, and nor is there one particular way of operating that gives me a result. Every single piece of that process is individual. Eyelid surgery is one of the most precise and detailed plastic surgery procedures, and that's because it's not millimeters, but it's fractions of millimeters that make a difference. All of us want our eyes to reflect a healthy and a vibrant appearance rather than a tired appearance. And sometimes through the aging process, or sometimes even genetically, patients can have extra skin, or they can have fullness and puffiness under the eyes that can portray a more tired appearance or a sad appearance around the eyes. The important thing about addressing eyelids is to really preserve a patient's original eye shape. We don't want to take too much skin out or take too much fat out so that the eyes look different. Rather, we actually want to add volume back, and I think that's one of the things I do differently than a lot of people is I focus more on enhancing the volume back to the eyes rather than removing or changing the eyes too much. It was really a nice opportunity actually to build the clinic from the ground up. We were working with a space that was completely open. It used to be a furniture store, so there were no walls at all. And just implementing the whole thought process of how do patients come in, how do they check in, where would they feel comfortable? What are we trying to relate to patients? What type of aesthetic sense? What type of philosophy? And then the functional aspects of it. How can I have my team in the optimal place so that they're as efficient as possible, that our operating room runs well and concisely and efficiently, and patients have privacy, yet they have openness. So all those things kind of went into the design. A lot of the elements and the fine-tuning things are a reflection of my own personality, and I think the space turned out excellent. One of the unique things about our clinic is the family dynamic that we have at Face Toronto. I say family, my wife's actually the director of the clinic, and I work side by side with two of my best friends, Dr. Donnelly and Dr. Alexander. From everyone from the nurses to the administrative staff to the front desk, everybody in our clinic kind of works so well together. We are like a big family. We're a boutique clinic. We are really friends on a personal level beyond work. And I think that really extends to our patients. Our patients become part of that family, and they feel that warmth and that genuineness that is portrayed in our work every single day. And I think that's something very special. I think mistakenly, sometimes people think of it as a vanity issue, and it really isn't. It's about people's confidence. And when I get to connect with people and relate to them so personally in that first consultation, where they may share things with me or certain insecurities that they've never talked to anyone about, and then seeing that at the end of that whole journey, when they come back and see me after they're healed and they're doing well, and the change in their confidence and the way they portray themselves, that's something really special to be a part of. And it's an amazing opportunity that I've had throughout my career.